The Gauteng Health MEC Nomantu Nkomo-Ralehoko says she is aware of reports of shortages of food at the Chris Hani Baragwanath Hospital, but that no patient has gone without food. At the same time, there appear to be some questions about whether that hospital is running into financial problems. Sibongile Tshabalala is the national chair of the Treatment Action Campaign. Sibongile, good afternoon to you. What are you hearing at the hospital? What are your members telling you about the situation there?
Because we are working with doctors and we are working also with communities, the situation is very bad there. And patients are supposed to be fed by the hospital, but families have a duty to say every day they make sure that their patients have eaten. And it goes up to a point where doctors, at some point, they need to make means, especially for those patients who doesn't have visitors, to make sure that they are eating. So they are taking out of their pockets money to buy food for the patient, or sometimes bring food from their homes so that patients can be able to eat. So the situation is really bad, and it needs a serious intervention, not to defend, not to defend, to MEC to defend themselves and saying no, people are sleeping without food there, because people are sleeping without food. And it's sad because this is not the first time that this is happening in Gauteng. Remember, in the past few years, it happened, I think it was last year, early last year, in Helen Joseph. There was a very similar situation. We've seen similar situations in other hospitals. One way or another, Gauteng hospitals are always in crisis.
So when the MEC says that patients have food, you say she's not telling the truth.
She's not telling the truth. We can't say people cannot bring food for their patients. People cannot make sure doctors buy food and making sure that they are bringing food from their homes to feed patients while there is food from the hospital. So she's lying.
Sure. So why does this keep happening, Sibongile? You referred to what happened at Helen Joseph Hospital. I mean, we've seen it's almost an annual thing. Accruals mount up. I'm talking about financial accounting accruals now. Hospitals run out of money. Is there a problem with the suppliers?
We don't believe that there is a problem with suppliers, but the problem is with the Department of Health not paying suppliers in time. But also the problem is with the corruption that is continuing to happen, where the tender system is always used in public hospitals. And when we use this tender system, it takes a lot of money out of the health budget. And we know that in Gauteng, Gauteng has been in the financial crisis from as way back as 2012, if I remember. So they have not been out of the situation. That is why every year they see themselves into these challenges. So what we think it should be done in order to save, especially the healthcare system of South Africa from this situation, is for government to inject resources to save the public healthcare system, like they are doing when they are saving ESCOM, they are saving SAA and other SOEs. So health also needs to be saved, but also we need the government to take a strong principle of stopping corruption that is happening in the Department of Health. One minute and another, we always get these stories of a corruption that is happening. Last few weeks, we were talking about what was happening in Tembisa. Now, Chris Hani Baragwanath Hospital doesn't have food. It's not because of this of the distributors, but the management of from the Department of Health, the financial situation of Gauteng put us where we are today.
Is it other things too? I mean, could it be things like hand towels, sanitizers? I mean, is the hospital having that problem too? It can't get enough of those.
You're talking about towels, sanitizers, even the toilet paper, it's not there. So hospitals are struggling to even have a toilet paper. If you go to any public hospital now and go to the patient's toilet, you will find that there is no toilet paper. Simple thing, a toilet paper. And sometimes nurses and doctors have to bring those things from home. Sometimes they have to run from one hospital to another and clinic to another. So I don't talk about linen, which it's always the case. It's always the issue. The linen is always dirty. The linen is not picked up because of poor services. So in most cases, and in what is happening, is that service providers are not paid in time until they take a decision not to supply. And that's only when a Gauteng department will respond to them and pay them, so that we keep our mouths shut, and then they continue not to pay others. So it means that they rob Peter to pay Paul all the time. That is why they are unable to sustain the financial situation of Gauteng.
Sibongile, this has been a problem for such a long time. And in fact, there was an amazing comment yesterday by the former Gauteng Health MEC, Mahlangu. She's giving evidence at the testimony, at the inquiry, at the inquest into the deaths of those Isidomeni patients. You'll know that story very well, but she's testifying about her role there. And she said yesterday, if I understood the reporting correctly, that when she was told in 2014 that she was going to be the Gauteng Health MEC for a second time, she cried because she knew it was a lion's den. Why is the Gauteng Health Department in particular such a mess? And I realize it's got a very high patient load. I realize people come from other provinces, other countries to be treated in Gauteng. But why is it still such a financial mess?
It's because we don't have leaders who want to take responsibility. You know, Stephen, when there is a challenge, it's always good that one takes responsibility to say and agree to say we have this challenge, and also come to the table and say, colleagues, we have this problem, or civil society or whoever that needs to be talked to, we have this challenge. How do we manage this challenge? But also the issue of corruption. You know, if you will remember, Stephen, in 2009, Brian Hlongwa stole about 9 billion in Gauteng. In when Kotani Mahlangu was, as she's sitting in that an inquest now, it's because she was trying to steal money from mental health, and they open bogus organizations so that her friends must benefit from that. And we are in this situation, one word, because of corruption. So corruption continues to happen while we are in cruels, instead of them prioritizing the health of people, prioritizing that people service to be paid off. They start to think, to say, how are they going to steal from the public purse, how they are going to steal from the Department of Health. We are in this situation because of not politicians not want to taking responsibility, including the deployment that is happening within the Department of Health. Remember, whoever MEC that comes will come with his or her own people, and when that person leaves, will leave also with their people. If you can look at the people who are working at the Department of Health, there are few who are still under that office who worked 5 years ago. So as much as we have changed the MECs in Gauteng, I think from the time we voted till now, there are about 3 or 4. So it means that every now and again, the administration is not sustainable because they change also the people that they come with. And irregardless that the administration that they come with, it has a professional or it has capacity to carry out the work, they don't care. As long as they have their comrades who will come and take the mandate and do their shenanigans within the Department of Health, that is why we see ourselves in this situation. So as we are preparing for the Presidential Health Summit, that will start tomorrow. Those are the questions that as civil society we want to ask the government to say, why are we continuing to have this conversation? Why are we spending so much money sitting here at Beachwood Hotel and having this conversation while people are not having food in one hospital, while Rahima Musa Hospital infrastructure, the found out showed that it's going to collapse anytime, while there are not enough beds in hospital, where there is a shortage of human resource. So there are a lot of issues that we need to talk about, but then we need answers. We are tired of these promises. We need committed government. We need political will. We need to see implementation happening on the ground.
Sibongile Tshabalala, thank you very much indeed, the National Chair of the Treatment Action Campaign. Really do appreciate the time.